Welcome everyone. This is Desi Vijay. I'm a North-South National Team member and a coordinator for webinars. Glad to see you all here today and hope you're all doing great. Today we are bringing in an interesting topic about your health and how to take care of it. We have here our own North-South parents as well as a doctor and nutritionist team who have been successfully advising many people in here as well as in India to improve their health habits and to take care of their health. They are here to talk about their knowledge, experience, and give you some vital information. And also here, they will answer all your questions about that. I'm really glad that we are able to bring that topic in here today, and then I'm glad you joined us. Let's welcome to yet another exciting webinar session. Thank you for listening. So let's move on to the main program. How to better manage or prevent type 2 diabetes, a doctor's perspective. We have experienced medical doctor and a nutritionist team amongst us here today to talk about the knowledge experience with us. They are also doing a great community service in disseminating knowledge in this country as well as in India. Are you able to see this screen, Dr. Amit?
Yes, so I see
30% of them are type 2. There are equally, in all four cases, 30% type 2 and 20% pre-diabetic, 30% as a family history, and 20% saying they are interested in this topic. So that's a great mix of audience you have here. So I'm sure this is going to be an interesting session. Let me introduce the panelists here for this session today. It gives me a great pleasure to welcome Dr. Amit and Komal Rastogi here today, today's session. In spite of wearing multiple hats and being busy, they have been very enthusiastic about sharing their experience with you all, and then I really appreciate that. Dr. Rastogi did his M.B.B.S. from All India Institute of Medical Sciences in New Delhi. He completed his internal medicine residency from St. Barnabas Medical Center in Livingston, New Jersey, and his fellowship in medical genetics from Johns Hopkins in Baltimore. He practiced medicine in India, New Zealand, and US. At present, he is an internal medicine primary care physician at Concord, New Hampshire. He is also clinical assistant professor at the Department of Community and Family Medicine in Geisel School of Medicine at Dartmouth, New Hampshire. He is a brand certified internal medicine and has a board certification of clinical genetics in the past. He is a fellow of the American College of Physicians, and he is a follower of and advocate of the lifestyle medicines. Komal Rastogi is not new to us, as she has already provided one webinar for us last year about the whole nutrition. She's a whole food plant-based nutritional lifestyle health coach. She's a graduate from the plant-based nutrition certificate program from Cornell. Since 2015, she has been working with individuals to help introduce, improve, and sustain health nutrition practices. To better serve the community, she conducts very popular and successful online and in-person group classes on weight loss and chronic diseases management through the whole food plant-based nutrition. All the classes are free of cost as a service to the community, and you all should make use of that opportunity. We are really glad to have this Rastogi team here presenting today's session. Let me join you in warmly welcome them and then educate us. Here is Dr. Amit Rastogi.
Thank you very much, Desiji, for that kind introduction, and thank you to the NSF webinar team to putting this together. And thank you for all the audience here who are participating. Thank you very much for joining us. So today we are going to talk about primarily just how to better manage or prevent type 2 diabetes. So of course, before that, I just want to have this disclaimer. I'll just read through this. Individual results are not guaranteed and may vary. This webinar explores the benefits of a whole food plant-based diet based on our personal experience and research. Sorry, just trying to sit here on the research lectures and studies of books authored by Dr. Dean Ornish, Neil Bernard, Michael Greger, T. Colin Campbell, and other leading experts in the field. The information in this webinar is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Always work with your physician or qualified healthcare professional before adjusting medications or making major dietary changes. We do not have any financial conflict of interest to disclose, as we do not have any financial relationships, nor do we consult for any of the products or services that might be described in this presentation. With that out of the way, I'll talk quickly about the objectives. So we are hoping to cover briefly, of course, the cause of type 2 diabetes and symptoms, complications of diabetes, and optimal nutrition for diabetes. So for the purposes of our webinar today, we will be, when we say diabetes, we'll be talking about type 2 diabetes. As you know that, there are, so there is type 1 diabetes, which is essentially an absolute lack of insulin, and usually it starts in early childhood or teen years. And then there is type 2 diabetes that we are going to talk about, that is primarily born out of insulin resistance. And then there is also, you may have heard of, diabetes 1.5, which is latent autoimmune diabetes of the adults. That's another category. So for our intents and purposes today, we will be talking about type 2 diabetes when we are saying diabetes. So what is diabetes? This, of course, I'm sure everyone knows here, essentially diabetes in terms of what it is in medical terms is defined as elevated blood glucose due to an absolute or relative lack of insulin. So type 2 diabetes as such is primarily insulin resistance. And just kind of put these, so at what numbers we are talking about. So normal fasting blood sugar should be less than 100 milligrams per deciliter. When we are pre-diabetic, we say it's between 100 and 125, and then in diabetics, it's 125, greater than 125, so 126 or more. There is another important number for your physician and also for the patient himself or herself. That's called hemoglobin A1C. That gives us about 3 months worth of blood sugar control idea when we look at that number. So that's a very helpful test, because all the testing in medicine is primarily point in time test, so this is more of a period of time testing. So normal is less than 5.7%. We define pre-diabetic as between hemoglobin A1C of 5.7 through 6.4%, and then 6.5% or more meets the definition of diabetes. Of course, to some extent, these definitions are arbitrary and they kind of are based on risks as entailed by these conditions. So of course, there is nothing absolute about what changes from, suddenly from 6.3 to 6.5, but it's just more a matter of definition and how, again, also for the risks for the reasons of public policy and health insurances. This is how these are defined. Very quickly, I'll go into pathophysiology, or meaning just the causation of, how this kind of comes about. So this is just a cartoon of a cell. On the right side, this is an insulin receptor. We are trying to show here, these are channels. These are called glucose transporters. In fact, they are actually residing within the cell, and they actually migrate to the cell wall when they are signaled by the insulin receptor. So insulin, you can think of it as a key. So insulin, of course, is a hormone that is secreted by or manufactured by one of our organs in the body called pancreas, and that's where insulin is coming from. So that's a hormone that kind of works on, and this cell we're talking of typically, either a muscle cell or a liver cell. They are the primary kind of utilizers or managers of glucose in our body. So insulin kind of may serve as a key to the lock. That's the insulin receptor, and that kind of then, for our intents in a simplistic way, opens up the glucose channels and the cell membranes that lets the glucose that is circulating in the blood coming through. So essentially on the right side, left side of this diagram or schematic, there are these channels, and these the small balls are the glucose molecules. We're trying to represent those. What happens in diabetes when we see that? These things are there, but then there is this accumulation of something called intramyocellular or intrahepatocellular lipid, which in English would essentially mean, either the fat content within the cell of a muscle or within the cell of a liver cell. And there, essentially, when that happens, in presence of intramyocellular or intrahepatocellular, meaning within the muscle or within the liver cell fat, the insulin is now not as efficient or ineffective in trying to open up those glucose channels, and therefore cell is unable to utilize the glucose, and the glucose is essentially just kind of staying in the bloodstream and therefore not being utilized, and we see increased numbers of glucose value when we do a test. So essentially this at the basis defines insulin resistance, which is kind of not only the cause of diabetes, and is also the cause of many of the complications that are associated with diabetes, also independent risk factors for many other maladies, so to speak. And there you can see those. It's a kind of a busy slide in the sense there's so much information there. Some of these arrows can also be bidirectional, meaning things sometimes so obesity would feed into insulin resistance, which would then beget more obesity. Same way fatty liver can do the same thing. These are not necessarily just one-way arrows, and you can see this kind of number of complications. So this is the central issue or problem with diabetes, the insulin resistance, meaning insulin is there, but it's not being as effective or efficient in trying to do its job, that is getting the cells of our muscles and liver, other body cells as well, to utilize glucose effectively by the mechanism that was just kind of explained. So what are the symptoms? Again, we probably are very familiar with those. Lack of energy, easy fatigability. Excessive thirst could be a symptom. Excessive urination could be a symptom. Excessive hunger could also be a symptom of type 2 diabetes or oncoming type 2 diabetes. And then sometimes unintentional or abnormal weight loss could also be seen in these. There are other also not so common symptoms, but again, these are the main symptoms. If these kind of many times would prompt us to seek further guidance. Why does it matter if someone has diabetes? It's elevated blood sugar, so what? And why does your doctor or your healthcare professional get so excited or concerned about you or your health when someone has diabetes? Why is it important? Because many times people could be asymptomatic and routine testing may unravel or show uncover the presence of diabetes, and the person might say, I was feeling fine. I don't know what my doctor is so hyped about. So it's primarily because the complications that it may get or it can lead to, because elevated blood glucose is seen by all the cells in the body, meaning it's not just kind of one organ system that is bearing the brunt of it. It's pretty much the whole body, because every cell in the body needs glucose. There are certain cells that can actually metabolize or use different substrate for energy production, but majority of cells just use glucose. And therefore, it's what we'd call in medical terms systemic disease, meaning not a local disease. It's a systemic disease. It just kind of affects the whole body. And you can look at the complications, and these complications are very real. We see those day in, day out. It breaks my heart, to kind of see that, many of these are preventable, and therefore, quite unnecessary. And of course, just I'd say one instance is one instance too many. So it increases the risk of strokes. Peripheral neuropathy, which is essentially a nerve condition where one may have either pain in the legs, feet, numbness, tingling, not feeling the floor or the ground underneath their feet, not getting any sensation at all. Diabetic nephropathy is essentially our kidneys get affected by diabetes. So type 2 diabetes is the cause of patients who are on hemodialysis or dialysis in our country here. That's the single most important cause for that's the reason why they got the kidney failure that cause them to be on hemodialysis eventually. Diabetic foot, essentially, that is because of the peripheral neuropathy. One may not, so we do not get sensations from our joints or skin. If there is an injury, there is a joint is in a bad position, our brain doesn't get that sensation, and we keep on using it in that same. It can, the wound can get, incurable or can cause systemic or bad infections, what we call sepsis, or, the joints may get disorganized. Also, there are some skin conditions that can occur there. Glaucoma is associated, which you may have heard of. Cataracts, early cataracts, uncontrolled diabetes can cause those. Diabetic retinopathy, this is the single most important cause of blindness in our elderly, other than macular degeneration or age-related macular, along with, I should say, age-related macular degeneration. So diabetic retinopathy, but again, these are premature, also premature vision loss as well. And then there is peripheral arterial disease, which again can lead to poor circulation in the limbs primarily. Heart attacks. So diabetics are at a significantly increased risk of heart attack, and that too silent heart attacks. And of course, a stroke. We kind of and of course, this is not an exhaustive list of complications. There are others as well, but it just kind of gives you an idea as to why it is important and how this kind of is relevant to someone who has or is at risk of having diabetes. Diabetes in South Asians. South Asian ethnic group carries increased risk of diabetes, increased vulnerability to diabetes. South Asians would develop type 2 diabetes at least a decade earlier than the Northern European groups, ethnic groups. And then the risk starts to increase as early as in our 20s. And then it's not uncommon for us to see patients who are in their early 30s, mid 30s, who already are with hemoglobin A1Cs of 6.8, 6.9. So again, that's important, and it's more likely to progress from prediabetes to diabetes. And I think it might also be kind of constituted as, so the progression from prediabetes to diabetes, sometimes, there is a time lag, and in South Asians, that time lag could be just kind of as short as even a year or actually a couple of months, as opposed to many other ethnic groups, where it might be actually a few years, 5 to 6 years. So traditional approach to treatment has been where, there is just kind of, so metaphorically speaking, that open faucet is essentially, the nutrition that we are taking. The clogged drain is that insulin resistance. And then, that leads to spillover, glucose in the bloodstream. And essentially what we are doing in healthcare profession and in our real many times are just kind of dealing with the aftermath, mopping up what is spilled over rather than trying to treat the causes upstream. And just again, so that is our traditional approach. So again, we're not working to kind of help fix what is coming through the faucet and deal with the clogged drain there. So just kind of as a statement of a problem, this is an article from Journal of American Medical Association from April of 2018. And this is just to kind of highlight, so this is the burden of disease, injuries, and disease risk factors in US, done from 1990 through 2016. And dietary risks stand out the single most important cause for the number of deaths and percentage of daily adjusted life years. So essentially, dietary risks are the ones that kind of set us up for these issues more than anything else, as you can see through this list. So with that in mind, I guess I would just let me turn over to Komal ji, who's a nutritionist and health coach and has been for the last 7 years closely following the patients and managing in their, of course, with their support and as a team with their diabetes and other metabolic issues. So I'll just make her the presenter here.
Yes. So I know that most of the people who are avoiding carbohydrates are the 50% of the audience who voted that carbohydrates they feel is the most responsible cause for type 2 diabetes or pre-diabetes or any kind of diabetes. That's a common notion, and we are going to cover in the coming near few minutes. So let's see, what are the responsible factors? Genetics, yes, it does play a role. So, but the role is not necessarily 100%. It's like we are more prone, if somebody has genetically, they have a family history of diabetes or any other chronic illness, they're more likely to get it, but it's because we share the same lifestyle habits as well with our family, right? So in our workshop, we have come across some of the patients who were the first ones to get diabetes in their family. So necessarily, it's not the genetics. So another thing, I'm going to mainly talk about is the lifestyle. So lifestyle is really, really responsible. This is how I put it, like we don't want to walk around much. We don't want to do much about exercise or anything. The moment we are home from work, or maybe anywhere, even grocery shopping, we come home and we are so tired and we just want to lay down. So another thing is, we are always thinking about food, right? And whatever comes on our way, or whatever knowledge you get from here and there, without checking the source, without checking the evidence, scientific evidence behind it, we just follow that blindly and we just eat whatever we feel like. So now the question arises, why me? Some of you might be thinking, oh, I'm so I have been eating healthy, I have been active, and maybe I have been avoiding carbohydrates, right? So why still I have my diabetes is not under control, or why am I still not feeling the 100% that I should be? So this is an analogy given by Dr. Klepper, and I really, really like it. So sharing with you, let's say that you went to the gas station and there were two options. One was gasoline, one was diesel. And you saw that diesel was a bit cheaper than the petroleum. So you started pumping diesel into your car. And then when you started your engine, the engine just blew apart. It wasn't happy. There was smoke coming out of the engine. And then you realize in the petrol car, you have added diesel. So of course the car is going to not work the way you want it to. Same thing happens with our diet. It affects on our health, what we eat. The more Western style diet, sodas, juices, added sugar, refined carbohydrates, processed foods, dairy, meat consumption, oil, ghee, butter, fried foods, the more onset of childhood obesities, overweight, obesity, hypertension, type 2 diabetes, cardiovascular diseases, high cholesterol, cancer, earlier menarche. All these things are, they have come into being more and more as we have started to, so to say, add more and more diesel to our petrol cars. So let's see now how nutrition can help. So through optimal nutrition, if somebody has chronic diabetes, like let's say they have a diagnosed diabetes for more than 8 years, they can reduce their medication. Even if they're on insulin, they can reduce the dose of insulin or get rid of the insulin by achieving a better blood sugar control. If the diabetes had been recent, less than 4 years, let's say, then there are much better chances of healing. They are, I have seen patients in my workshop who have gone off of the meds because their doctor thought that they were no longer diabetic. So they did not need any medications. They did, their hemoglobin A1C was around 5.7 or less than 6. And pre-diabetes, yes, it is a reversible condition, 100% reversible condition. Just put some effort towards it and you don't have to be a diabetic. Now, treating diabetes, we always have two options, right? In any case, whether it's diabetes, cholesterol, hypertension, or any other illness. So one is medications, the other is lifestyle choices, what we put on our dinner plate. And again and again, I want to emphasize this, that when we are talking about diabetes, diabetes starts from our dinner plates. Genetics, yes, it makes you more vulnerable, but the diabetes starts from your dinner plates. So what happens that, we have these both choices, but when we try and we go to the doctor and we tell them, and Of course, they talk to you about, that how you should watch what you are eating, but you don't know what to eat, right? So we don't ask any questions. We say, okay, you are giving me medication, let it be. And our friends, they also don't care. You tell them, oh, I am a diabetic, I am taking all these medications. There would be no questions asked. As soon as you will try to change your diet, even if you are feeling better, there would be lots of questions. Even your friends who were not concerned about your health ever, they would come up and say, oh, why are you not eating that? Why are you eating that? Or why are you, why you're making these changes to your lifestyle? All those things start to happen. So that kind of can lead us to a peer pressure. So if in case you are ready to take the second choice on your lifestyle, I would urge you to please bring a pen and a paper. Just note down a few pointers that I'm going to share with you, and they might actually help you in the long run. So, powerful menu for diabetes. Zero animal-based foods. Zero animal-based foods would mean that eliminate meat, fish, seafood, eggs, dairy, and dairy products such as ice cream, cream cheese, butter, ghee, lassi, chaach, anything that comes from animals, just eliminate it. It's not that difficult. Believe me, when you set your mind to it, you will not find that it is difficult. Zero added oils, whether it is the coconut oil, whether it is the mustard oil, olive oil, canola oil, anything that is industrial oil, just put it aside. Keep it out of your kitchen. They are good for massaging your skin or hair. They are good, like for many other uses. There are other uses, but please do not add those to your food. In India especially, we have a habit of starting every gravy or every vegetable that we make, any dish, we start pouring oil in the pan. Stop doing that, and it will make a big difference in your life. It will make a big change in your fasting blood sugar numbers. And the numbers, as soon as you start making the changes, it is seen that within the 3 or 4 days, the numbers start to come down. The blood sugar numbers, they start to become better. Low glycemic index foods. Now, some of you might know what glycemic index is, and for those who do not know, I am going to talk about it in the next slides. Dietary fiber. Dietary fiber is, I'm not talking about the dietary fiber then when you go to the market and the label says, oh, this bread has so and so much fiber, or this kind of boxed cereal has so much fiber. I'm not talking about the advertisements. I'm talking about the real fiber that comes from nature. Let's include salads before each and every meal. Start your meals with the fruit salad or a vegetable salad, whatever kind of salads you need. Maybe switch your breakfast to a healthier one. Switch your breakfast to eating oats rather than going out for another kind of boxed cereal, or going for any other bread piece, or the any whatever breakfast we are taking. So just switch your breakfast to rolled oats or the steel cut oats. Stay active. This is necessary if you are right now, maybe you're not being that much active, so just start with a 20-minute of walk every day. Maybe just go for a walk or a swim or whatever suits you, or yoga, and just the most important part would be stay active. What is glycemic index? A glycemic index is, it is a number that indicates how rapidly any given food releases sugar into the bloodstream. For example, if I'm going to eat a lollipop, or maybe I'm going to eat a candy, or maybe just the fruit juice, so they are high in glycemic index because they have the they are going to release sugar into my bloodstream very rapidly, as opposed to when I switch to maybe whenever I crave sweet fruit or sweet something, I can just reach out for grapes, I can just reach out for mango, or nature has given us all these flavors, the sweet flavor and savory flavors, all are in abundance in nature. We just have to just think, change our thinking. So low glycemic index menu. Simplest way to stick to the low glycemic index foods is to eat what is grown, not what is made. So I like this quote. It says, let's pay the farmer, not the pharmacist. And, it's important every time you go for a grocery shopping, just, think about these points. Choose intact grains over processed whole grains. So this is a point I like to share because I have, when I work with patients, whenever I tell them to switch to a healthier breakfast, let's say oats. So the common thing I have found is that people would grind the oats and make it into a pancake or a dosa. Don't do that. It changes the glycemic index of the food. So choose intact grains over processed whole grains. So eat chickpeas, split peas, beans, lentils, lots of vegetables and fresh fruits. So now here again, just so that the low glycemic index, this is the key, in addition to avoiding the animal-based products as well as avoiding the oil. This is the key. So low glycemic index, maybe I'm just going to give you some of the examples what you can eat instead of what, and that might help you. Instead of the white rice, choose brown rice. So one of the reasons would be white rice does not have much fiber. So this comes into the category of refined carbohydrates. So everyone who's concerned about carbohydrates, this is your key, that avoid the carbohydrates that do not have any fiber. So try to switch to high fiber carbohydrates or the low glycemic index foods. Instead of the instant noodles, go for the whole grain pasta. Yes, pasta is allowed on this. When you have diabetes, we hear pasta is not the best food. You can eat pasta, add lots of vegetables to it, but it should be whole grain pasta. Don't go for the instant noodles. Instead of the processed snacks, maybe boil kala chana or makhane or popcorn. Make your own snack. We have recently learned that if there is this toasted soybean, you can make it at home. It's very easy. Just soak the soybean overnight, and in the morning just let them dry and bake it in the oven and roast it in the oven, and they are ready. They are crunchy, they are healthful. There is no added salt or added oils to that. Fruit juice. Instead of the fruit juice, please go for the whole fruit. Whole fruit will help you more because it has fiber. Nature knows how to protect us from all these illnesses. Tea, instead of having it with black milk, animal milk, go for black tea or green tea. Roti, we usually, the Indian households who like to make roti with the wheat flour, please try to mix in at least 40 grams of kala chana besan. So this kala chana besan is different from the besan, the yellow besan that we get. Kala chana besan is the black chana, ground with its skin. So it will lower the glycemic index of the roti and it will help you. Now, what should we eat? Again, it's an evidence-based lifestyle. It consists of mainly four food groups. Whole grains such as brown rice, quinoa, amaranth, millets, all those things. Lentils, you can eat whatever lentils you like. Lentils and beans, chickpeas, urad dal, black beans, kidney beans, moong dal, whatever you like. Vegetables, all kinds of vegetables are open, even if you are type 2 diabetic. Eat lots and lots of fresh fruit. The only exceptions would be very ripe bananas, watermelon, and pineapples. Those are the 3 exceptions. Otherwise, you can eat whatever fruit you like. Additional habits to adopt. For those who are writing it down, either you can, click a picture of the slide or, just note it down. So own a blood sugar monitor. It is very important that you check your fasting blood sugar regularly and keep a log. Stay hydrated. Get hemoglobin A1C checked every 3 to 6 months. Intermittent fasting. Do not eat after sunset or after 7 p.m. It will be, believe me, it's very, very helpful, whether you're trying to lose weight, whether you're trying to get better at your, type 2 diabetes numbers, blood glucose numbers, or the, cholesterol level, or the hypertension, high blood pressure numbers. So intermittent fasting is actually really helpful. Do not consume anything that has calories after 7 p.m. and try to fast for at least 12 to 14 hours. Do not sit for 30 minutes after eating your meal. Maybe go for a walk, maybe walk around the house, or maybe do anything, any physical activity that you like, but try not to sit down for 30 minutes after you have eaten your meal. Reduce the number of meals, preferably to 2 to 3 meals. So here there is no portion control, that I emphasize, or anything like that. You can eat as much as you like. Eat till you're happily full. Just eat the right way. All I'm asking is that eliminate the food that actually causes disease. That would include, again, the animal-based products, oil, and high glycemic index foods. So avoid refined carbohydrates. The simple definition for refined carbohydrates is the processed food that has been ripped off of its fiber. Okay. For example, fruit juices. Fruit juices hardly have any fiber, and even if they have the fiber, it is not going to work the way it would work in the whole food, whole fruits. Talk to your healthcare provider about the new diet change and medication adjustment. So again, if you're going to make these changes, check your fasting blood sugar regularly and keep a log. Your doctor might want to see this, and your medication might need some adjustment. So it is always good to know that losing 10% to 15% of body weight, it helps with intentional weight loss. It helps with the type 2 diabetes. Adding exercise to your daily routine helps. So 2 of the books that I would recommend if you are into book reading, one is Mastering Diabetes by Dr. Khambata. The author himself is a type 1 diabetic, and he talks really nicely about how to master this diabetes. And there is Dr. Neil Barnard's program for reversing diabetes. You can find these authors on YouTube as well. So these are the 2 books that I would highly recommend. And recommended cookbooks, there are many cookbooks that might be helpful. One of my favorite ones to recommend is Forks Over Knives. And the first few pages will tell you what you need in your pantry and what not. So I am grateful to our local, bookstore. If you go to our, they are offering 20% discount on any of the books that I recommend. So they have, if you go to my website, it's namastearogya.com. You can go to the resources list, and under the resources list, there is book list, and you can just click on that and you can receive 20% discount on all these books.
Okay.
So if you're looking to change your lifestyle for the betterment of your health, this is how another ways we can help and we can be of service to you. We run regular free of cost group classes for step-by-step guidance. So these classes we meet usually once a week, and then then you make the changes, dietary changes slowly, and these classes meet for about 6 to 8 weeks. And these are very successful programs, I mean, so to say, and I have felt very happy, to see the results of the participants. And all our services that we are listing on our listed on our website are free of cost to the community. And my husband, Dr. Rastogi, he runs a free telemedicine clinic for current residents of India. So anyone that you know of who can make use of this, facility, so this service, please encourage them to go to our website, namastearogya.com, and they can book an appointment. So since I had been emphasizing so much about, you should stay active, so there's a gift for you. One of my local yoga studios, they have been offering one yoga class pass. This is worth $20. So to register for this class, you can go to www.hothousenh.com, or you can email mike@hothousenh.com and just mention namastearogya.com or Komal Rastogi, and you can get your free class. They conduct classes in person as well as online. So I'm sure this will just get you started if you have never tried yoga. We are ready to take any questions that you might have. Thank you for listening.
Thank you.
Thank you both for an excellent presentation. And the audience, please recommend this to your folks in India, because they're doing it in a time convenient to them also, these sessions, and particularly our aged old parents who are all there, they would like to learn some of those things and then put it in the practice for their longevity and their good health.
And the classes are conducted in English as well as in Hindi. We have both kinds of sessions, Hindi sessions as well as English. They are practically, they are the similar material, other than the guest speakers might vary, depends, but they are the similar material that we share. And you can also go to our YouTube channel. You can, if you go to my website, it also lists our YouTube channel. I have tried to put some of the videos, very short videos about how what are the dietary changes that you need to make for type 2 diabetes, and how you can, if you are fond of milk, how you can make your own plant-based milk at home. Thank you.
Thank you. So let's go to some questions we have, and please post your questions, and then we'll try to address every one of them in the order I receive. The first one I have is, for a vegetarian, you can't avoid a glycemic rich food. I guess even the supposedly protein rich food like lentils and beans are rich with carbs. Is that true?
We are not trying to avoid the carbs here. Again, I think maybe you missed the slides where I was trying to share that carbohydrates are not our enemy. First of all, this is what we have to understand. Carbohydrates are important for our health. They are the preferred fuel for your body. So you cannot just avoid what they prefer, what our body prefers, right? So the main culprits, if you're trying to find out, is as vegetarians also, if you're lacto-ovo vegetarian, which means you have dairy and dairy products, as well as the eggs, poultry, eggs, all these things in your diet, please remove those and try to avoid oils at any cost. Do not add any of the oils to your diet, and your numbers, if you are diabetic, your numbers would start to improve.
Okay. Do you have any comments about the low glycemic rice?
Yes. So the rice that is high in fiber, rich in fiber, that would be, you can use brown rice. And red rice, if you can find red rice, it has even 4 times more the fiber than the brown rice. So they are relatively low in glycemic index.
Okay, that's a good advice. And when you are saying no oil, so how would we cook the meal without oil? And can you elaborate?
Sure. My question to you, just ask yourself, if the stove is off and the pan is cold, can the oil cook the meal? It cannot. So what do we need to cook the, whatever masalas we are putting in, or whatever the cumins, or, maybe mustard seeds? We need heat. So you just start dry roasting the vegetables or the whatever masalas you are going to put in. So there's no oil needed. We have been cooking for many years without oil, without adding any oil. I mean, I was very fond of oil. More oil, more colorful it would look, but there's no difference. Believe me or not, there's no difference. You cannot feel difference in your taste. All you have to, it's like you just have to trust. It's not gonna burn. Nothing is gonna happen to it.
If the Western diet is not recommended or seen to be high cause of diabetes, would we not see higher percentage of Caucasians with the diabetes?
See, there's a factor called genetics, right? I have black hair because both my parents had black hair. So genetics, I think, plays a big role. And I think, Dr. Rastogi, you can maybe address this question more than I do.
Okay, yeah. So as I said, there was a slide in there. So we of South Asian ethnicity are at a higher risk. We are more vulnerable, and we are not the only population in the world that are known to kind of more vulnerable to diabetes or acquiring diabetes. There are others, Paima Indians, also, some populations that are living in Arctic circles, they are more vulnerable to acquiring diabetes. So are we, so South Asians. So we are at risk. I mean, again, yes, you're right. There are. It's not that it's the processed food is helping anyone, but yes, some of us may show signs and symptoms of the ill effects of consuming those foods sooner than others, and I guess, such as the observation, other than avoiding those, there isn't any much guidance that we can give on that. Thank you.
Yeah, I think it's not that we have not seen in our in our workshops. We have had the privilege of meeting patients, who of course, it's a privilege, when somebody trusts you. So they were non-Indian, non-South Asian community, and the only thing, as Dr. Rastogi said, in Indian community, the onset of type 2 diabetes is earlier than the other population. So Caucasian population, usually the type 2 diabetes, I have seen patients, we have had patients in our workshops, the onset is a bit later in life than sooner. So yeah, it catches up. How soon it catches up, it's just, it's genetically, I think, it's dependent.
Thank you. I'm a type 2 diabetic and an occasional social drinker. What's your recommendation?
Please remove oil from your diet. If you want to remove your alcohol, that would be really beneficial. It would be beneficial for your actually cholesterol, for your heart, for many other reasons as well. So please watch your diet very carefully. If you have type 2 diabetes, again, I would encourage, Desi ji is going to repeat the, share the recording with us, all of us. So maybe you can look through the recording once again. You can come and join our workshop. It's free of cost. You can also go to our YouTube channel. Take care of your diet. Remove all the oils and the animal-based products. Plus, with the alcohol, one of the things that I have learned is that, when somebody is consuming alcohol, even doesn't matter how frequently it is, processed foods are something that you would start to consume along with, right? So they are not helping either. So that way, it's not a good situation. Dr. Rastogi, do you have anything to add to that?
No, so again, I agree. I think it's those associations that are kind of harmful, as well as acute. So again, probably a drink or two would not do it, but if it's more than that, it can adversely affect our serum triglycerides, which is kind of one of the fat species or lipid species. Also, it can adversely affect our blood pressure. So again, I mean, there aren't really very strong guidance against, again, as I said, if we are looking at a lifestyle, it's best to avoid it. Just for an example, there have been studies published in Lancet, which this was quite a few years ago, that doesn't matter, and I'm kind of a little bit digressing here, what kind of carbonated drink you drank, whether you drank, sugary drink or the one that was sweetened with artificial sweeteners, or which did not actually have any calories. The risk of diabetes was about 50% higher in those. And now it's thought that it was more because, when we are consuming those kind of carbonated drinks, and we are kind of usually also having more, if I may use the term or the phrase, junk food with that, processed food with that. So it's by association that was kind of how that was seen to be affecting this. So I kind of agree with Komalji here, that yes, I don't want to say, a drink of alcohol would cloud everyone's judgment. It might for some, but yes, it's more likely that we are to partake things that are not helpful along with it. So again, to everyone, I guess it's to manage their lifestyle as positively as it can to positively impact the disease or the underlying issue that there is. We recommend not consuming it, but it's not like an. I would say, like like Komalji says, no oil and no animal products. They are kind of more of a culpable there than alcohol is. A drink may be okay, but we don't recommend it. Thank you.
Thank you. Thank you. You are basically recommending to avoid all animal fats as well as ghee, milk, cheese, nuts, etc. So you think vegan is better than vegetarian?
Now, vegan, yes, French fries are vegan, right? Beer is vegan. So I would not go for vegan, the term vegan. I would go with plant-based, nutrient-rich plant-based diet.
Okay.
So in the name of vegan, there are so many processed foods that you can find, right? Oreo cookies, they are vegan. Potato chips, they are vegan, candies, sodas, they are all vegan. Yes, there were studies done. If we are talking about vegans have a better, they have a smaller waistline. They have, better health in terms of, as compared to when we are talking about omnivores. But here, I want to emphasize on whole food plant-based lifestyle, which would mean no oil, not only avoiding the animal-based foods, but also avoiding the refined carbohydrates as well as avoiding the oils. Thank you.
Thank you. And what do you think about jowar roti for diabetics?
Yes, you can have that. What I have seen in my workshops that every body is different. So some people, they would have jowar roti and the blood sugar would not go up, but for some it was not working. So if you can add 40% of kala chana besan atta, kala chana atta to your jowar roti, that would be really helpful. So the best way to check is whenever you have switched, maybe like you are eating jowar roti and if you are diabetic. So within next maybe 60 to 90 minutes, check your blood sugar again. If it goes way higher than 140 or 150, then this is not working for you.
And for a South Indian, would you recommend quinoa to brown rice because they don't like brown rice?
Yes, quinoa is good. I mean, I learned, of course, we learn from each other. I learned from someone that they did not like brown rice. So, they would mix a few of the grains together. She would add a bit of brown rice and a bit of quinoa, a bit of amaranth, a few of grains, and then that is how she used to. And I have seen that actually comes out really good. You can also try oat groats, which are the whole oats. They work as well as rice, and they have a very different and chewy taste. So just try different grains, go to the grains section of the market and try a few different whole grains. Again, they should not be processed grains.
How can we join Komal Madam's classes for weight loss and change lifestyle?
Sure, just go to my website, www.namastearogya.com, and it has a few buttons, Hindi series, English series, so join any of those, and they are starting in January. Thank you.
Thank you. And diabetes being a progressive disease, what is the practical expectations on reducing the HbA1c for chronic diabetic patients?
Okay, I think Dr. Rastogi would also add to this, but in our workshop, we have seen patients who have had diabetes for more than 30 years. They have been able to, and on the maximum dose of medication, and still their A1C was around 9 point plus. And they have been able to reduce it successfully to 6, and that too with, reduced medication over time. So yes, you can reduce your medication as your blood sugar would start to improve. Medication is a helping hand, but mostly our diet actually plays a major role. So Dr. Rastogi, would you want to say anything?
Yes. I guess the question, the way it is put, that has been the traditional thinking about diabetes. It's a chronic progressive degenerative disease, and no matter what you do, you can manage it, you can't cure it. And that is true as long as we continue with our same ways as we had been when we actually acquired the disease. If we can make substantial and lasting changes to our lifestyle, to, like Komal is saying, go to the unprocessed or as little processed food as possible. It's not always possible to kind of completely reverse it. Like I think there was a slide there in the talk today that statistically speaking, of course, like we say, individual results can vary. But statistically speaking, if someone has had less than 8 years of type 2 diabetes, there is a chance that it could be reversed. So yes, there have been instances in our patient population where if someone was recently diagnosed and they kind of, if I may use again the phrase, mended their ways in terms of how we were eating, they have actually lost their diabetes where they did not have to be on any medication. But yes, the vulnerability remains, and that thing that essentially, so dietary indiscretions would again bring us back to the same place where we started from. So essentially that is important to know. Yes, it is manageable. But again, I mean, if someone has had 20 years of diabetes, they have already complications that have ensued and changes that have taken place. So it may not be completely reversible. But yes, we have seen, like Komalji was saying, that there has been reduced need for medications. I guess one of my first patients was, where I was just trying to prod her to start insulin all the time. Every time I would see her, I'd say, your hemoglobin is like 10, A1C is 10 and 9, and I'd say you have to start insulin, and she was so reluctant to do so. And when we actually learned of this many years ago, we kind of I urged her to take us up on this, and she did, thankfully. And we got her hemoglobin A1C down to 6.8, and then I had to actually reduce some of the medications. So that was kind of, I'm not saying that it's the only case, but yes, that was one of the cases that I remember very clearly. So again, yes, I don't think it can be reversed, but can be managed well and with maybe less medications. Thank you.
Thank you very much. There are still a few questions about how can I cook without oil. So the question is also
Faith.
Between butter or margarine or different types of oil, is there a grade you can provide which is better, not better?
So see, it is made in the industries. It's not grown in the nature. We don't have an oil fountain in the wild, right? So please do not go for any kind of fat if it is concentrated fat. For example, it can be margarine, it can be oil, it can be butter. So avoid all kinds of processed fat. You want, I understand, if you have teenagers at home, they need some calories coming from fat as well. So give them dry fruits, give them, there are so many ways to compensate, but we do not need that kind of added fat. Please be careful. Let me give you an example. For example, nature gave us, let's say, walnuts, right? So the hope was, how many walnuts at a time can one pick from the plant, and then maybe open the shell of the walnut and consume? How many can we do that? We cannot do many, right? But as soon as this industrialization came into being, we have now shelled walnuts, we have walnut oils, we have all this stuff going on, and hence our health is also declining. So please try to avoid all kinds of fat. There is no, I cannot recommend any. Thank you.
And if I may add, on our website, there is a short YouTube video, I think, where Komalji is actually making dal, or actually, sauteing the dal and tempering it without the oil. So yes, just kind of, I know that's not a medical question, but just wanted to add that there is, you can cook it without oil. There are videos to that if you want to.
So you can also go to our, I'll just share this with you. I think, our website, and then under the resources, there are certain for, recipes and all. So there are certain links to the videos. There's especially one that, kind of gets into this whole food plant-based diet is Dr. Esselstein's daughter, Jane Esselstein. So she has her own YouTube channel. You can see how they cook, and there is Chef AJ. All those resources, just please go to our website and look under the resources part. They will be helpful to you. I do understand, it's very for those who are listening to this thing for the first time, that you can cook without adding any fat or any added concentrated fat or oils. It might sound, why and how can we do that? So there are people who have been doing it, and they have very generously put it on the YouTube.
Thank you very much. Is there any benefit to, you talked about intermittent fasting 14 to 16 hours. Is there any benefit to extending the time to maybe 24 hours?
Dr. Rastogi?
So depending on, so fasting does help, but again, I think we are talking to an audience that actually does have diabetes. There you have to be careful with fasting because you might be on medications that actually lower the blood sugar. And also, so there you have to be, you have to work in sync with your doctor or healthcare provider. But yes, again, if someone does not have diabetes, fasting even a 24-hour, so some again like a 24-hour period, and then like maybe doing that once a month, once a week, those things are known to be helpful. There is data on that. Intermittent fasting, ideally, those who are doing on a long-term basis, ideally a 16-hour fast is recommended. But again, then it's kind of sometimes it's hard. Again, depending on what can fit your lifestyle, any lifestyle that you can sustain is worth pursuing, as opposed to trying something intermittently. So yes, there is value in doing that, but for diabetics, we do not recommend doing that, primarily because you might be taking medication on a regular basis that can lower the blood sugar, and hypoglycemia, that is low blood sugar, is a dangerous complication, a potential complication of any diabetic who's taking treatment either with insulin or certain other medications. So you have to be very careful doing that. So that's that. But again, and there is data. If someone is looking to look into that.
So with the intermittent fasting, and if somebody has type 2 diabetes, I think start slow. Even if you don't have type 2 diabetes, you're just doing it, because you feel like. So start with 10 hours. That is what I would recommend. Don't all of a sudden start with 16 hours, because you want to practice, as Dr. Rastogi said, do something that is sustainable. If I tell you to not breathe fully and just breathe a little at a time, then there would be a time when you would just feel suffocated, right? We don't want to do that. Start with 10 hours and then go from there, 10 or 12 hours, 7 to 7, and then maybe start to increase, but not too much. So again, if you're diabetic, you need your breakfast, healthy, hearty breakfast, and then lunch, and then maybe light dinner. But yes, get rid of the grazing habit. If somebody's doing this intermittent fasting, that does not give us a license. Okay, there is a 6-hour period or 8-hour period where we would like to eat. So not just go munching, every half hour or every 15 minutes or 2 hours, So limit your meals to 2 to 3 times a day whenever possible, and make those changes slowly. They should be sustainable. Thank you.
Thank you. And perhaps this one is again to Dr. Amit. What happens if you miss metformin for a month and the person is taking 1000 milligrams a day and H1AC is, A1C is 7.5?
So this is a specific question. I would advise that that the gentleman or lady should get in touch with their doctor to kind of have that addressed. Just very generally speaking, though, metformin is a medication, is one of the few medications in diabetes that we use that thankfully does not commonly lead to hypoglycemia, that is low blood sugar. It may. If someone, I'm just kind of taking a hypothetical case, if I'm seeing someone who has a hemoglobin A1C of 7.5% on metformin, I would say that they need to stay on metformin. If their hemoglobin A1C is 7.5 without metformin, I would say that they need something on board, or modify their lifestyle to bring it down. 7.5 is high. You want your A1C to be closer to 5.7, as close to 5.7 as possible. And then again, if someone says, my hemoglobin A1C comes to 6.5 or 6 when I was taking metformin, do I not need it? I usually use this analogy. I say, if you are applying the brakes and the speed is still higher than what we wanted, you need to keep the brakes on, as opposed to thinking that, oh, I don't need the brakes now. So those are certain things that I do kind of bring that up. But this is a specific question. I think the person should direct to their physician or healthcare provider who they are seeing, because I think it has a very specific detail that is needed, and just kind of giving a generalized advice might be a little bit risky here. Thank you.
Thank you. Thank you. The next one is, what's your comment on salmons? That is one of the recommended fish to eat. Consuming at least 2 servings of salmon per week can help you meet with your omega-3 fatty acid needs.
Omega-3, okay. We are concerned about omega-3. Omega-3, I would recommend, switch to the plant-based sources. They're healthier, they are better. They have fiber, they have other micronutrients. So those resources would be eating handful of walnuts each day, or flax meal. Add flax meal to your lentils or whatever, just pour it over your morning oats maybe. And chia seeds. These are the 3 very good plant-based resources. Now, again, we want to focus more on fiber intake. Animal foods, whether it is fish, whether it is dairy, whether it is meat, anything, they do not have any fiber. They are 0 fiber. So please include high fiber diet and do not go for omega-3 capsules. Just add walnuts and again chia seeds and flax meal to your diet. That would be a healthier version, much healthier version. Thank you.
And thank you. And what do you think about soy or oat or almond milk instead of regular milk?
That is a good, you can do it. So here the thing would be that I usually recommend that if you can make almond milk at home, do so, because then you can control how much sugar goes in there and you know what you have added. But if you don't have time, by all means go to the market bought. And coming to the soy milk, especially for women who are at who have cramping problems during periods, or have near to the menopause, right, the hot flashes, soy milk is really helpful. 1 serving a day would make a difference. Thank you.
Thank you. The next one is, how is calcium supplemented if you avoid milk or yogurt?
Okay. Yes, I know we have these all these common myths. Calcium, there is enough calcium in the nature that can be found. Just calcium-rich foods are the green leafy vegetables and your lentils and beans. So go with those, and regular supplementation of calcium is not recommended. It's not a good idea. So go with what you can get from nature. Add more and more green leafy vegetables to your diet. Maybe go for kale in the morning. If you have never tried kale or arugula, go for those. And of course, nature is smart. They have before the capsules were invented, nature has provided us with everything, in abundance, actually. Dr. Rastogi, do you have anything to add to this?
So I agree with what you said, of course. But the only other thing was that I actually was at this was International Conference of Nutrition in Medicine just last month, and there they kind of shared the same thing. So not only the green leafy vegetables have more calcium, it has a higher bioavailability than milk. So milk is touted to be the source of calcium. And it's not, I guess it's traditionally that is kind of ingrained into us, but from the plant sources, if we are, again, as long as we are eating the variety and having what like an appropriately planned diet, there is enough calcium which has better bioavailability. In addition, because we are not consuming excess protein, in this diet. Also because calcium acts as a buffer if we have acidic, more acidotic food, which is primarily comes from the amino acids, that are in protein. So that kind of exerts excess pressure on our kidneys, and then so calcium is buffering that. So that is also kind of minimized. So in any case, I think. I 100% agree. There is plenty of calcium around in plant source foods.
So if in case, when you ask the calcium question, in case you are worried or concerned about the bone health, I would, just want to say that, not just calcium, we also need exercise for good bone health, So include green leafy vegetables and, stay away from animal-based products, as well as add some activity to your routine. That would be helpful. Thank you.
Thank you. I have a low BP, so what foods are good or foods to avoid for me?
I think,
again, low BP, again, it's kind of a little bit ambiguous term there. But again, if the person is not having any symptoms, or such as feeling lightheaded or tired all day, tiredness again could be because of a number of reasons. Then again, if this is a concern, again, they should consult their physician or a healthcare provider. And again, as such, we really say, there are certain times, yes, when we would call it kind of hypotension or low BP per se. But again, if the person is not symptomatic of that, usually lower BPs are associated with better survival and actually less comorbidities. But again, I think this is again a specific situation where there is a concern. I think personalized and personalized professional guidance would be of value and use here. Thank you.
Thank you. The next one is, are frozen vegetables as nutritious as the fresh ones?
Okay, yeah, they come second. Of course, they are good because they have been picked at their peak and then frozen, So they are good if you don't have time. But if you do have time, I would encourage you to join the local community, supported agriculture, the CSA. Look for local CSA and go for fresh vegetables. They are, as much as you can, because I do not know if salads and for salad, fruit salads, you would need fresh vegetables and those things. But of course, again, if you have a busy schedule, frozen vegetables are good too. Thank you.
Okay, thanks. And someone is asking, can you give an example of what you eat in a day? For example, your yesterday's menu?
Yes, sure. I can give you yesterday's menu. So we have been eating oats in the morning for the past many years now. So usually steel cut oats, I just boil it in the water, add some Ceylon cinnamon to it. That makes it sweet. We don't feel the need of, and we don't add any sugar to that. Instead of, to make it sweet, because all of us like sweet oats, so we add fresh fruits on top. And in the evening, I had boiled, black beans with brown rice and lots of salad um, on top. So that is what, and my son, he made guacamole yesterday. So that was our dinner. So on Saturdays and Sundays, we try, we practice eating twice a day, because we don't feel the need. It's, when you're eating high fiber or, low glycemic index foods, they actually stay with you. You don't feel hungry, in like maybe in 1 hour or 2 hours. So yeah, thank you.
Thank you. Thank you for sharing that. And in your opinion, what's the difference between organic and non-organic produce?
Organic ones are always, better. See, in my personal experience, what I have seen is, we have a cooperative store near to my house, and they sell everything organic. All their produce is organic, whatever they're selling. So I go and buy my rolled oats, or the steel cut oats in bulk from them. And as like, I used to think, at least in my head, I used to think that if I switch to organic stuff, that might be actually costlier, right? But it's not the case. If you can find a place, like the conventional oats are costlier than what I get in bulk from my local cooperative store. So just maybe go around, and if you can find organic stuff, it is always better. Thank you.
Thank you. And do avocados help with the omega-3 as a source?
Avocados are very rich in fat. So as we are aging, like Dr. Rastogi's one of the slides that I really liked was the open faucet, right? So we don't want to clog our pipes with too much of fat. So be very careful if you want to, add avocados to your diet, not more than 1/4 avocado per person per day. That is the limit. And for omega-3, again, 3 of the best resources, plant-based resources, are walnuts, chia seeds, and flax meal. I do not think that, I'll just check, maybe I don't know, but I don't think that avocados are a good source of omega-3. Thank you.
Thank you. And the other confusion for all of us is artificial sweeteners versus sugar.
Oh yeah. So this is a fun question, because see, when nature made, it did not intend us to be fooled by the sweet taste, right? If we were eating something sweet, let's say I was eating grapes, so then my body knew, okay, there is something, I taste something sweet, that means there is calorie coming in, so it would start to release the insulin, right? But what we are doing with artificial sweeteners, that there is, body doesn't know this yet. So it takes thousands of years to evolve, right? So we are tasting the sweet thing on our tongue, and the body says, oh, there is calorie coming in. So the insulin is released, but there is no calorie, because we are just, doing it for the fun. And what happens, that insulin starts to go around in our body, and it will eventually make you hungry in 1 hour or 2, and then you would start, usually people start eating more, they consume more calories at that time. So that's one of the reasons that artificial sweeteners, or the diet sodas, they are associated with higher with an increase of hemoglobin A1C, as well as increased weight. Thank you.
Thank you. Let me go through. What do you suggest for older people who cannot walk for more than a few steps as some exercise?
Yeah, I think, if you can just, even when you're sitting down, just do with something with your arms, maybe just stretch them out, stretch them up, do something. All those muscles, the muscle health is necessary for us. And that is what I do understand, it's kind of sometimes difficult, but still I would say, start to eat healthy. Switching that part would also be helpful. And I feel, Dr. Rastogi, do you have anything as a geriatrician, if you could add?
So again, I mean, I think, yeah, whatever activity that they can partake would be helpful. And even though, diet, so diet is not just the half. I think it's more than, in my personal opinion, it's kind of more than half the part of the equation here. Dietary changes would still, and there would be a palpable difference if they do make the dietary changes, as they are recommended, zero oil, zero fat, and no animal products. So there would be a palpable difference in the health. But of course, optimal health requires both activity and diet. But again, so I again agree, of course, whatever they can do, that would be good. If and essentially, just kind of still make the changes in the diet, that you would feel the difference in your health. Thank you.
And does stress play a part in diabetes?
Yes, stress does play a part in diabetes. Actually, stress does play a role in many of the chronic inflammatory diseases and chronic degenerative diseases. It does play a part in our aging. I mean, again, we might think of it as the slope is downward for all of us, in terms of how our faculties are going to go after age 30. But the steepness of that slope can be moderated by our lifestyle that includes stress. And it is known, the only issue with the stress is that kind of it's that tangible, intangible, meaning we all know what stress is. Stress is real, but I can't tell you, I'm under 500 pounds of stress or 550 pounds of stress. So yes, general answer is yes, it does make a difference. And if there is a way to manage your stress through meditation, yoga, or whatever you have found your way to kind of get to your happy place, that makes a difference. Yes, thank you.
Thank you very much. We are actually over time by about 5 minutes. So you want to wind up here, or you can take a couple more questions?
Yeah, it's up to you. We can take a couple of more questions.
Okay.
Thank you.
Yeah. There are a lot of people still hung up on the oil business and then say,
I know, and I have experienced that in my workshops also, that, but again, I would encourage, if you could come and join my workshop, because there you will meet a community with like-minded people who have invented different ways, such as, some people, they would just, do their masalas and then immediately add some water to that instead of the oil.
right.
There are different ways. So yeah.
And are air fryers better to cook?
Yes, air fryers are a good thing. I like them. I mean, depends upon what you're trying to do. Like my husband likes to roast peanuts in the air fryer. And we have recently discovered the roasted soya bean, as I was telling you the recipe before. So yeah, those things we do in the air fryer. I think they're a good option as long as you avoid the oil.
Okay. And then probably I'll end with this question. In the world of eating out, or for social or for business travel reasons, what's your suggestion on food selections?
Yes. So again, if you have time, please come to the workshop. We cover all these topics in detail. So one thing I would say is, rather than going to the restaurant, rather than looking for a restaurant wherever you go for a travel or staying at a hotel, please try to go for look for a grocery store. And then my husband, I think, can you explain what did you do on your last trip?
So of course, whatever I'll be telling you is kind of taken more from Komalji's advice, So essentially, when I go for business travel, so one of the ways is, especially, if for an evening you are going out for a business meeting, you usually know what restaurant is going to be in, and we would usually research their menu. Most of these are available online these days. If you don't have one, you can always call the place in advance to speak to the chef or the manager, and they're always happy to accommodate. You're giving them business essentially. So they usually accommodate. There are a few things that are kind of universally available, and I agree. In our workshops, Komalji kind of goes in depth in these, because these are practical questions living in today's world. Yeah, when we go for, so I was at this conference, I was saying, in last month, in DC. So actually, that was an international conference in nutrition and medicine. They had sumptuous plant-based meals. So that wasn't a problem for breakfast and lunch. For dinners, I actually ordered online through Whole Food. They delivered in the hotel. And of course, it's not home food, but there was stuff, to just kind of fill yourself up, So those are. And they're also much more affordable solutions, than actually going out. But again, I mean, if I'm going out with friends, I usually would just kind of research the menu there, and there is always, I mean, I'm not saying 100% of times, there might be exceptions where you do not find what you're looking for, or there might not be one thing, but usually, even if there is something that is mixed with cheese, meat, whatever, you can ask the chef to kind of make it without those ingredients. And as I said, most places are happy to oblige, because again, they are looking for business and clientele. So it's doable, but it does need a little bit of forethought, before you show up at the place.
Thank you. And I really want to end with this one because that's a popular one. What do you think about keto diet?
Okay. Yes, you want to take up on that question, sir?
So keto diet, in the short term, so that analogy of of the open faucet, where there's kind of the whatever we are getting is in terms of our nutrition or calories, and then the clogged drain, and then the rest of what is not going through the system is kind of spilling over. In that analogy, essentially, I think that's a very pertinent one. As I showed in the initial slides, the thing that is actually causing us to have insulin resistance are those intracellular, so some people call ectopic body fat. They have used this term. So the fat in the cells is essentially begetting or causing that insulin resistance. Keto diets in the shorter term are helpful in the sense in losing weight in of themselves, like Komalji had shown, 10 to 15% weight loss. No matter who you are, where you are, what you're doing, with your diabetes, that would have a salutary effect on blood sugar control in the short term. In the short term, the blood sugar would also go down because you are suddenly reducing the carbs. But what we are ending up doing with keto diets is that we are actually clogging that drain up more by eating higher fat, high protein diet. And it's seen and it's known, when you go off of that keto diet, things are usually turn out to be worse. So that's a very short-term fix, and it's not a fix at all in my understanding. It's just a very stopgap measure. There are certain medical situations where keto diet is one of the go-to solutions, especially like in seizure disorder that are uncontrolled. But typically, in terms of current nutritional science, that is not a diet that we would recommend at all. It has short-term gains with long-term significant issues and problems. It's harsh on your kidneys, and also on our arterial system and all. So we would say no to keto diets, but
yes, again, carbohydrates are your body's preferred fuels. Please do not avoid carbohydrates. That is, we just go to the market when it says low carb diet, low carb diet. We just automatically start to assume, okay, yes, this is what I need, right? High protein or protein bars. We start to assume, okay, we need to focus on protein. Those are marketing stuff, please do not fall prey to those. And it's better that, eat a nutritious, well-balanced meal. Thank you.
Thank you very much. Thank you, Dr. Amitji and Komalji. We ran over about
Thank you.
More than 10 minutes, but
thank you for giving us the opportunity.
Very interesting and very educational, and I can thank you enough because this is a subject everybody is always asking themselves. Thank you everyone for sharing your for being with us and then asking all those questions, and then learning from this and attending the webinar. I again thank Amit ji and Komal ji for their time and their patience in answering all our questions and educating us on this most important topic.